219-845-1100. Let's go to Harold on line one. Harold, what's up?
Good morning, Jim. Good morning, Doctor.
Good morning.
I had a couple of questions. There's been a lot of changes over the last few years. A lot of doctors are not treating certain patients. Are you still engaged in the treatment of Medicare patients?
Yes, absolutely.
And Medicaid patients?
Yes.
And how about something like the Healthy Indiana plan, which is a lot of the young people have had to enter into?
Yes, yes. We are credentialed with all of those insurances.
Okay. That's just kind of a general question, but I know there's a lot of changes, and a lot of the doctors are not doing that.
Yes, it's actually.
Thank you. I'll get off and I'll listen.
Okay, and that's a very good observation. And I was talking to you about staying in business, and healthcare has become just as much as any other business and it is focused on revenue. With the Medicare spending changes and the reduction in the reimbursement to physicians, they are anticipating almost close to 30% reduction in reimbursements to physicians and healthcare facilities. So it becomes an important decision for each of these physicians' offices to see will they be able to afford to continue to practice if they have 80% of federally insured patients versus 60% of federally insured. So we have to make our own calculation and see, is this even viable for us?
So why are some doctors not taking Medicare, Medicaid, Healthy Indiana HIP plan?
Absolutely, yes. Yes.
Why are they not doing it?
Because private insurances have better reimbursements. So you'll have to see probably 3 Medicare patients in order to make the same reimbursement from one private insurance patient. So there is a lot of, and we are already significantly time crunched for healthcare delivery here. You're supposed to see so many patients in an hour, and we are expected to document A, B, and C, and if you don't document, you never did it, according to the lawyers and the insurance administrators. So there's so much of requirement for physicians, so they are literally desperate.
3 Medicare patients to kind of make as much money on that or to get you to your cost level as one private insurance.
Correct.
Really?
Yes, and it's going to be even worse. What is expected, hopefully, the legislators will make some good decisions in the coming years. They are anticipating that the Medicare reimbursements will even drop less than Medicaid reimbursements.
Doctor, it's not all about sitting in the office and seeing patients. It's not all about making the rounds, prescribing medicines and so forth. You have already mentioned it, that there's kind of you have to be more of a generalist at times, and you have to learn the business end of
Absolutely.
medicine. So you're making a big step. Tell us about it.
Well, if you look at the trend in healthcare delivery in the United States, more than 90% of physicians' practices are going to be owned and administered and run by larger organizations, primarily hospitals. Now, that's not a bad idea, wherein physicians will just clock in and clock out, go see their patients, and they're out of there. But for me, over the years, I have been employed. The first 6 years of my professional life, I was employed. And now for the last 4 to 5 years, I'm on my own. And I find a different passion in this. Here, I'm able to be more creative. I'm able to cater to the needs of the patients. And by understanding what the business aspect of healthcare is, I need to understand the economy that is surrounding this healthcare policy, the billions of dollars that is spent in healthcare delivery, in order for me to be able to provide the best service to the patients. So if a patient who has Medicare comes to see me, I cannot treat them the same way I see private insurances, especially with pharmaceuticals or medications. The cost of medications is so high that it will be impossible for them to be compliant with taking these medications. So I need to know, what does Medicare Part D mean? What would be the cost, out-of-pocket cost for this patient, so that I can balance certain generic medications with the more important medications that are more expensive. So I have to know the money, the business side of it, in order to be able to do it right.
And so what are you doing about that?
Well, yes, I am going to be starting a physician executive MBA program with the Indiana University in September, and I'm very excited about it.
Physician Executive MBA.
Yes.
Did you, when you started out in medicine, do you think you'd ever be going on this course?
No, my life in the last 11 years has made me think very different. I don't expect anything in life anymore. I just want to enjoy what I have and be able to give and enjoy by giving. And I think it's a great, blessed position to be in. And it just came my way. This Physician Executive MBA was, I received a invitation from Indiana University, and I just spoke with some of the founders of this program, and they were very excited, and I got excited, and here I am. Went through the interview process, and I got selected, and I got also a partial scholarship to go through this program.
So.